Hello, everyone. A very good noon to you, and welcome to a new session of Assurance Talks. So, our today's webinar is all about vitamin D and B12 Essentials, your path to better health. So, our today's speaker, Dr. Seema. Hello, everyone. A very good noon to you, and welcome to a new session. Hello, everyone. So let's get started. So our today's speaker is Dr. Seema, who is a family medicine physician at NanoHealth with over 15 plus years of experience. So before we get started, let me share my slides. Hello, everyone. So let's get started. So our today's speaker is Dr. Seema, who is a family medicine physician at NanoHealth with over 15 plus years of experience. So before we get started, I hope all of you can see the slides. So why we actually chose vitamin D and B12 deficiency as a topic for today's webinar is because our recent corporate statistics. So we did a survey in our recent, most of the corporates, I'm just showing the out of from many four corporate statistics. So all four corporates shows that about 85% of their employees were suffering from vitamin D deficiency. Whereas when it comes to vitamin B12 deficiency, almost 35 to 40% of employees were suffering from vitamin B12 deficiency. So only if you know this kind of statistics, you can actually streamline or give an efficient target to your employers, or you can efficiently put your money to specific employers as well. So that's why we choose this topic. And since it's a boom right now, the vitamin D deficiency. So without taking much of your time, let's get started. Hi, Dr. Seema.
Hi, good afternoon, everyone. Dr. Seema here. Today's topic is vitamin D and vitamin B12 significance, its deficiencies, and the symptoms associated with that.
So, when I say so, let's get started with the first basic question that everybody wants to know, or I'll say that even I want to know. So first is that what is sunshine vitamin?
Okay, so vitamin D is called as sunshine vitamin because it is manufactured by the skin of the body in presence of sunlight. So it needs ultraviolet rays in a medium, in a mild intensity. So that's how vitamin D is formed. So this is a very good source of vitamin D, free and easily available.
Okay.
So that is why vitamin D is called as sunshine vitamin.
And we also know that from sun we get vitamin D.
Vitamin.
Sun is the source of that.
The skin manufactures. So your skin area, the area of your body or your skin exposure should be more to get more vitamin D. All right, correct. So yeah. So the best time to get vitamin D is like morning time between 7 a.m. to 9 a.m. And there the ultraviolet intensity is less. Okay, that's the right intensity that is required. You can get vitamin D even after like 12 p.m. also, but but there are harmful effects of ultraviolet rays because they are in high intensity. So we can avoid that. It is best recommended time is 7 a.m. to 9 a.m. 15 minutes of daily exposure would be sufficient to get the correct amount of vitamin D.
Okay, so who are basically prone to get vitamin D deficiency?
Right. So vitamin D deficiency is common among people who stay indoors, who confine themselves to indoors. Like it's very common nowadays amongst people, especially the corporate employees. We go to the offices and then early morning, and then by the time we reach home, it's already evening. So we hardly have any exposure to sunlight. So and women who stay indoors, and in those part of the world where the sun comes for a shorter period of time, in those people, and people who are obesity is also associated with less of vitamin D, and elderly people, because their skin is not capable of manufacturing vitamin D as it used to when they were young. So vitamin D deficiency is common amongst this population. And also people with the darker skin, like in Africa and all. So lighter skin will make vitamin D faster, whereas the darker skin is it takes a little time. So that is also one of the factors. These people are prone to have vitamin D deficiency.
So what happens if we actually ignore this deficiency?
Yeah, good question. So vitamin D deficiency, like why is vitamin D important? Vitamin D is important because it has a major role to play in bone health, right? So bone is composed of calcium and phosphorus. These are the minerals. And when this mineralization happens, the bone becomes strong. So vitamin D is essential to cause incorporate these minerals, calcium and phosphorus into the bones. That's how bone gets its strength from. So if vitamin D is lacking, though the patient is taking enough of calcium in his diet, enough of phosphorus, but still, if you check the patient's blood, it will show enough of calcium and phosphorus. But still, the bones will suffer. They will not be strong. They'll be weaker. So these people will are prone to get fractures easily, right? So we cannot ignore. Again, it depends upon the intent, like how vitamin D is, how much is deficient, like mild, moderate, or severe. Mild and moderate, you will not see very specific symptoms very clearly, but when it is severe, the symptoms are very clear. And mild and moderate, you can still do without it. Without vitamin D, though the body will be suffering. Unless you are aware and oriented, you know what are the symptoms of vitamin D, you will miss it. So because it also has a big role to play in immunity of the person. There's a study that shows that people who are asthmatic and who have this dust allergies, if they have vitamin D deficiency, they have more episodes of asthma and more infections, upper respiratory tract infections. So it has a role to play in immunity also. So there's a study that shows. So it is important for mental health as well, right? Though it's a mixed study, not an extensive study has been done on this aspect, but it shows like very promising link between depression, anxiety, and mood disturbances. They are connected to vitamin D deficiency. So, and apart from that, it is also responsible for muscle strength. So there's something called floppy baby syndrome, where the child, baby or toddler will not have like hypotonia, muscle tone is less, and the baby is cannot walk properly, and cannot hold things. So these are all the symptoms that you will get, and hair loss also. The hair industry, when you go to a dermatologist for alopecia, apart from thyroid and other blood tests, they also ask for vitamin D levels. This is also one of the cause of hair loss. So these are all the symptoms that occur because of vitamin D deficiency. And short-term deficiency, body still can manage, but long-term deficiency will have a serious effects on immunity, bones. And there's a strong study linking vitamin D to cardiovascular health also, heart and the blood pressure. Yeah.
Okay, so I heard of a disease called as rickets. So it's associated with vitamin D.
Right, right. So rickets is a disease that is found in childhood in children who have not exposed to sunlight, who have dietary insufficiency of vitamin D. So in that, what happens is that the long bones, the weight-bearing bones, the leg bones especially, they are soft because I told you that mineralization is important, calcium, phosphorus, and they bend easily on bearing weight. So you get bow-shaped legs. That is called rickets.
That is rickets.
Yeah. Even the skull bones are like softer and they become enlarged. So there's something called box skull that's happening in children. So yeah, there are a lot of symptoms. So this is very common, rickets.
So how you actually manage or see the symptoms? What kind of symptoms actually shows that you have a vitamin D deficiency?
Yeah. So as I told you, these are the roles that they have. The vitamin D has to play, right? So one is the bone health. Second is muscle strength. The muscles are weak, gait like the baby is falling off easily, especially the toddlers. They're not able to stand and walk properly. And the other thing is easy fractures, like frequent fractures. Then you will have this question mark of it could be a vitamin D deficiency. And people who are having cognitive, thinking abilities declining, memory loss, and depression and anxiety. In those people also, the vitamin D will be like if they go visit a psychiatrist or a neurologist, he will ask for vitamin D. Yeah, vitamin.
So it's not proven yet, but there are studies showing a relation between.
Yeah, there is a link. Yeah.
Okay, so let's get to vitamin B12 deficiencies. So first, I will see that how vitamin B deficiency is important. Why it's so important?
Okay. Before going to vitamin B12, let me just give a quick sources of what are the sources of vitamin D. One is sunlight we talked about. Other thing is we have the diet, the dairy products, especially the fatty fishes. They are rich in, that's why you have this cod liver oil capsules available. You might have seen the advertisement. These contains vitamin D. So one is diet, and second is supplements. If the vitamin D is deficiency is severe, then we can give vitamin D tablets. Injection is also available, and yeah, this is about it. And the sunlight exposure. Yeah.
So far we all only know sunlight.
Yeah.
So that's why. Okay. So why is vitamin B12 important?
Yeah. Like we talked about vitamin D. It's important for bone health and muscle strength, and so vitamin B12 is important in nervous system maintenance, in a good health of nervous system. What is nervous system? Brain and the peripheral nerves supplying the arms, limbs. So that is why it is important, and deficiency will lead to problem in these areas. Yeah.
Okay. So we heard that people are taking an injection of neurobion.
Yeah.
So is it related to vitamin B12?
That's right. Yeah. So in people with severe vitamin B12 deficiency, neurobion injection is given as we give vitamin D injections also in severe vitamin D deficiency. So neurobion injection is given so that they'll get the levels to optimal levels of vitamin B12.
So is vitamin B12, or is it a myth that vitamin B12 deficiency occurs more in vegans or vegetarians?
Right. So vitamin B12 is the source of vitamin B12 most commonly is animal derived protein. It's like meat, fish, eggs, egg yolk, and so a larger part of vitamin B12 is derived from this. There's little that is derived from other sources, plant-based sources, but the quantity is less. So that's why the vitamin B12 deficiency is very common in vegans, and to some extent among vegetarians.
So how the vitamin B12 deficiency affects our brains and nerves?
Right. So vitamin D deficiency is is associated with dementia or amnesia, memory loss, and inability to think clearly and to process information, making a judgment. These are all connected to fine qualities of the brain. These are affected due to vitamin B12 deficiency. And the nerves, peripheral nerves, that is the nerves supplying the limbs, they get affected. And as a result, the person suffers from tingling, numbness, sensation along the limbs, and pins and needles sensation. And this is especially bothersome in elderly people. It interferes with their sleep. So this is found. Yeah.
So is chronic alcoholism also affect vitamin B12 deficiency?
Right. You're right. So vitamin B12 is also associated, deficiency is also associated with chronic alcoholics because alcohol is an irritant, and that makes the inner lining of the stomach inflamed.
Okay.
So that is where the vitamin B12 absorption occurs. And apart from that, there is something called intrinsic factor that is produced by the stomach, inner lining of the stomach. That is important for absorption of vitamin B12. So in people with issues in the stomach, like chronic gastritis, there's something called atrophic gastritis, where the cells get destroyed.
Right.
So, and in the case of chronic alcoholics, where the cells get inflamed and they do not produce enough of intrinsic factor. So vitamin B12, though you're taking enough in your diet, it's not absorbed because of lack of this factor. So that is why in chronic alcoholics, vitamin B12 is very common deficiency. So we give them injections and supplements.
Not because of their diet, but because of alcohol.
Exactly, because of alcohol, what it does to the lining of the stomach.
Right. Okay. So is vitamin B12 also recommended to pregnant females?
Yeah. So vitamin B12 and vitamin B9, which is called folic acid. Folate. Yeah, these two are associated. Usually one is deficient, the other is also found to be deficient. So as I told you in the first part of the talk, that vitamin B12 has got a big important role in maintenance of the nervous system. So brain and spinal. So when the pregnant lady, the fetus brain is developing the first 4 months especially. So the vitamin B12 is very important because it will lead to brain defects or nerve tube defect, we call it. Yeah. So brain of the child will not be completely formed, or it will have some defects. So that is why in Anganwadi, government has made it a very strict rule to include vitamin B12 as soon as the lady is pregnant.
As soon as the lady is pregnant.
Yeah, in the first
so
few months.
over the course of
the whole 9 months, she'll be taking vitamin B12, folic acid, so that she will not have the fetus with neural tube defects or the brain defects.
Brain defects. Yeah. Okay. So what are the sources of vitamin B12?
Okay. So the sources of vitamin B12 are, as I told you, animal sources mostly: eggs, milk, dairy products, cheese, butter, and what do you call it, poultry, meat, and fishes. These are all good sources of vitamin B12. There are some plant sources also I like to mention about. There are sprouts that are rich source of vitamin B12, and dates, cashew nuts, and some fruits like some vegetables like spinach, beetroot. These also contain vitamin B12. Right. Yeah, even fortified food like dosa and idli, fortified fermented foods like fermented foods also give have enough amount of vitamin B12. But as I told you, the quality is not that good. So animal proteins are needed, but people who can't take them, they have to take supplements. Vitamin B12 supplements. Oral or
injections. So what is preferred more, oral or?
It depends upon the severity of the vitamin B12. Mild, moderate oral medications will be sufficient. But if it is like severe, they need to take vitamin B12 deficiency. Vitamin B12 injections.
So what's actually treatment of vitamin B12?
That is what diet. You have to modify your diet, include dietary foods that are rich in vitamin B12. and take supplements. It is like moderate and severe. And injection will be needed when the vitamin B12 defect is like severe. Another important thing is vitamin B12 has important role to play in RBC formation also.
Correct.
RBC. So lack of vitamin B12 leads to anemia formation, right? So that is also one important role, important reason to include vitamin B12 and folate in pregnant ladies. Anemia will lead to issues for the fetus, right?
That's right.
Yeah. So
is like vitamin B12 affects the blood cells even when you are an adult?
of course it does. It does, because each RBC's span of life is 120 days.
Right.
Then it gets destroyed and new RBCs are generated in the bone marrow.
If that generation, because of
That is affected. That is affected. Somewhere during in the pathway of vitamin of RBC formation, vitamin B12 is required. So if that is less, then number of RBCs produced are less. So to compensate for that, each RBC will become bigger.
Bigger.
So that's called megaloblastic anemia.
Right, right.
Yeah.
Okay.
Yeah.
So that's why it's directly affecting
Yes, RBC cell anemia. Yeah.
So if you see both of the thing deficient in your report, then it's actually correlated.
It is correlated. Yes.
Yeah, so that's very nice, and so we really got to know a lot about, because when it comes to vitamin D, we basically think that sitting inside or in our dietary, we cannot change anything to actually get vitamin D. It actually comes from the sun. But
it is one of the source and cheap and easy source. Yeah,
just have to sit inside.
Yeah.
Yeah, but when it comes to the specifics of it, like we have to sit in the morning, that will actually give you the benefit most. And people that are even doing an evening walk, or that doesn't affect much as compared to the morning hours. Yeah, that's something that we get to know from the professional only.
Yeah,
because there are a lot of myths when it comes to the diseases or when it comes to deficiency.
Every disease has myth, especially
All kind of correct. So when it comes to vitamin D, I don't think that right now people take that much of seriousness when it comes to nutritional deficiencies.
Yeah.
Because maybe it does not show that severe of a symptom until and unless they are like
severe state.
Minute, yeah.
Yeah.
They're just minute in your body. So that's why an awareness is required to make it more important to people to actually look into it and get tested before anything serious happens. Because I know there's a recent story, actually one of my friend who had severe vitamin B12 deficiency, but there was no such symptom. So in the morning when he was going to his office, he was feeling sick, little weak. But you know that when it comes to work, we all are like, okay, chalo, asto, we will go. So even he drives a two-wheeler. So he even don't remember why he fall in middle of the road. He just fall in middle of the road. By God's grace, it was just red light and the traffic was not moving.
Yeah.
So it was
This
just
is very important.
Yeah, just saved by a
miracle. Yeah.
Yeah.
So yeah, that's what every living being needs macronutrients and micronutrients. So macronutrients are something that we take in bulk: carbohydrates, proteins, and fat in a decreasing order, in that order. And micronutrients are also equally important, which most people in India, like in third world countries, do not know or do not care about much.
Correct.
Because unless something is like serious and severe, that only gets their attention.
Yeah.
Because they don't prioritize health here. So micronutrients are needed in minute quantities, but they are needed. They are essential because a lot of reactions are occurring in the body that require vitamins and minerals. So yeah, that's why only when we get tested, went to a doctor, got to know that yes, like nothing, no vitamin B12, there was not. So then he took injections and still he's in a recovery. It's not like he can stand for a longer time. So yeah, that time only you get to know, oh, it is very important and you have to get checked. Then you realize it's not working for it. Correct. Then only we react. campaign for it, then maybe we'll tell our relatives and all that, okay, no, I suffered and please don't do that. Yeah.
We react to a situation. We don't actually proactively work towards not happening that particular situations. So that's a very nice talk. We got to know a lot about both of the deficiencies, and I really hope that people take seriously. So I'll say it here that we at NanoHealth are really dedicated, or I'll say that we are mostly doing our work efficiently to make it more lively, or make it more productive when it comes to corporate, because like I showed in the corporate statistics that 80% of their employees are suffering from severe vitamin D deficiency, and about 35 to 40% are suffering from vitamin B12.
It decreases the productivity.
Correct.
Also.
It decreases the
yeah, because the person's cognitive ability is also disturbed, and he's irritable, mood changes. These are all important.
And that all affects productivity.
Yeah, it affects
and that's why in our I'd say that our platinum package that are actually curated by the global experts, we have included vitamin D and B12 tests, so that you come across only the statistic shows that what needs to be done.
Right.
So I'll just do a brush up of what we have discussed today, and then we'll close the session. So that's the statistics that I was talking about. Okay. So in relation to vitamin D, its importance, deficiency sources, vitamin D is also called as sunshine vitamin. And so why it is important, what role does it play, what are sources of vitamin D deficiency manifestations, whether it's a short term or a long term, and how to actually avoid vitamin D deficiency. So for vitamin B12 deficiency, which also helps in neurological health, mainly comes to cognitive decline, peripheral neuropathy, gait disturbances, irritability, pernicious anemia, because vitamin D is directly related to the RBC formation, importance in pregnancy, sources that actually helps you to avoid this kind of deficiency. So
so I forgot to tell you about this picture. This is called geographical tongue. So it's like a map drawn on the tongue. So this is also one of the vitamin B12 deficiency. The tongue becomes swollen, and there'll be cracks, and like part of the tongue looks like this. So once it is and a loss of taste, like decreased taste sensation also will be there. So once it is corrected, it goes back to normal.
Normal. Yeah. Okay, it goes back to normal.
Of course, it's reversible. Once you use vitamin B12, then it goes back to normal.
So it comes when it's a severe deficiency, or
moderate deficiency, and it's not necessary that everybody with moderate deficiency should have it, but it is one of the symptoms. Yes.
Okay, thank you. Thanks a lot, Dr. Seema. It was really a great session. We got to know a lot about vitamin D and vitamin B12 deficiencies. So thank you all for joining us. I hope that you enjoyed the session. So please do log in, and please do meet in our next session next month. And please do take care of your health. And if you for some reason miss this session, you can any time look at this session on our channel, on our assurance channel. So we'll meet you next time, and thank you so much, Dr. Seema. Please take care of your health.
Thank you, Arishi, for having me. I hope it has provided the right information. People take heed and adapt it in their lives.
Thank you.